Now we come to the second point, most important. After seat of action, you know the seat of action where the remedy is acting. The next question is, how does it act? That is known as kind of action. What kind of action does this drug has on the disease or the organ parts? For example, you know the liver is affected. Okay, liver is affected. But then which remedy we can give? There are 10 remedies for liver. There are 20 remedies for lungs maybe. How can we give? Now a physician comes with a very difficult task of determining which remedy has to be given. And here is the catch. An organopath will come and say, oh, I know the remedies of the organ, seat of action I know, but he'll be utterly confused which one to give. Let me give an example. For example, a pneumonia. We know that in pneumonia, exudation happens, inflammation happens, hemoptysis can happen, pain can happen, fever can happen. So organopath will come and say, oh yes, I know there is a remedy. He needs a remedy for lung because pneumonia is a symptom of lung. Lung is affected. But to find out exactly which out of these 10-20 remedies which I know for lung which is acting, I don't know which remedy to give. To understand which one to give, I will have to take the patient through clinical trials or clinical experiments. But here a homeopath comes and says, not to worry, I don't need to take the diseased individual for clinical trials. I have got an encyclopedia, drug proving symptoms. I have got Matra Medica Pura. I know like a remedy, phosphorus produces exact symptoms of exudation, hemoptysis and pneumonia like inflammation of lungs. So if the symptoms collaborate, maybe that remedy or maybe some other remedy from my drug proving symptoms or Matra Medica Pura I can match. So homeopath will do nothing. He will try to match all the manifestations which the disease is given. He will try to match the subjective and the objective symptoms which has been taken down, which has been taken in a proving symptom in his book, in his Matra Medica Pura, and he will match and he'll be happy to give. Here the limitation for an organopath comes. So just as a homeopathic physician, if we just know the seat of action, it is not going to help. Many a times, a lot of people come, a lot of students or colleagues, call me and ask me, what is the remedy for cancer liver? What is the remedy for renal colic? There is no remedy for a disease. That's what homeopath says. But yes, seat of action is definitely important. The sphere of action is definitely important. But along with that, we need to know the kind of action. I'll give you a few examples. For example, liver remedies. Let's take 3-4 remedies. Cardus myrrh, Chionanthus, Cornus circinata, Chelidonium. Cardus myrrh, when you read Cardus myrrh, basically Cardus myrrh is also a liver remedy. It has got jaundice, it has got ascites, okay. But when you read properly Cardus myrrh, you will find out in boric that it has got affection on the portal circulation, portal congestion, varicosities, varicose veins. So patient coming to you with liver affected, along with that his portal circulation is hampered. He has got varicose veins or he's got piles or portal circulation is damaged, then basically Cardus myrrh could be the remedy. Chionanthus, when we see Chionanthus, I'm just opening Chionanthus in boric and how beautiful it is written. So boric you can open Chionanthus, not Chionanthus, CHI, Chionanthus. It is said it's a remedy for periodic sick headache. So liver affected, along with that periodic sick headache, a migraine, a mild headache is always there. Along with that, gallstone is affected, gallbladder problems would be there, diabetes is there. These are the conglomeration, or basically spleen is also affected and jaundice is also there. So you can see the same remedies, Chionanthus on liver, Cardus myrrh on liver, both have different affinities. Cornus circinata, again a liver remedy. But when you read Cornus circinata, it says, in first line it says, vesicular eruption from liver affected or stomatitis, aphthous stomatitis. So that patient with liver complaint will have stomatitis, or they will have on the skin vesicular eruptions. This is the kind of action. When you read more cornus cercinata, the drug knowledge when you take, you will find out there's a lot of diarrhea, and the diarrhea is like gelsemium, a nervous excitable diarrhea. You can go in NAIR and find out. Diarrhea or dysentery from nervous excitement, cornus cercinata is the remedy. So now when I was reading this and through my clinical experience, I have come to this point that there is actually no specific remedy. Though seat of action, sphere of action is very important to understand, but there are no specifics in homeopathy. I get really pissed off when I see people on social media channels or in pharmacies. They give remedies for diseases. They give remedies for organs. Yes, there are remedies for organs. That's why organopathy is such an important part in homeopathy. But they fail to understand that kind of action is what has to be known. So all the people who are listening to me, if you really want to understand, all the doctors, if you really want to understand the mother tinctures, the specific drugs that we have, because in boric we have got drugs which are not well proved, but they are very potent remedies. I'll tell you, even in boric, if you read, like I gave few examples now, you read between the lines, you get to know the concomitants, the diseases that they are suffering along with that, and few other physical symptoms. That is the distinguishing factor when you want to give those remedies on organ specific, because there are times when the totality is smart, you don't get, or maybe the injury is so bad, liver is affected or lungs are affected, you need to give a specific remedy. You might need, but you cannot give it on specificity. Individualization is the key, even when you want to prescribe on seat of action or a specific remedy. That is the point that I understand from Burnett. And who is talking? I'm talking from Burnett, Burnett Tumors. Burnett, who is known to give specific remedies, keep changing. He is talking about this. He is saying that organopathy has its limitation. You need to know, you need to learn your mater medica, you need to learn the drugs. Even if it's specific, you need to know how it is acting. What is the kind of action? Thank you very much.